What are the tests you must run or the tests you must do before making babies? Are you a man or a woman and you want to start producing kids? What are the tests you need to carry out on your body before you proceed to making babies to avoid making mistake, to avoid stories that touch? Please, if you do not carry out this test, better avoid making babies. I'm going to be mentioning them, with the last one being the most important test. Okay, so listen till the last one. First of all, is no longer news. Like, almost everybody knows that before you start making babies, both the man and the woman have to go to the hospital to make sure they do not carry any infectious disease like HIV, AIDS, syphilis, and what have you. These diseases that can actually, get transferred to the babies. Okay, so if there are any of these diseases detected, they can be put under control of, if there are ones that can be cured, you better cure them before making babies, so as not to transfer them to your baby. That one, everybody knows about that. I presume that. The second one is genotype. Almost everybody knows about genotype as well. Yes, that if you are an AS, you better do not have anything to do with an AS partner, okay, to avoid making babies with sickle cell anemia, which can be draining, which can be, it is actually stressful on the child, on the part of the child, and on the part of the parents. So to avoid this stress, you have to be careful not to not to partner with someone that is not compatible with you genotype wise when you want to make babies. Okay, that one, like I said, almost everybody knows about that. Another thing is you have to check his blood group. Okay, when I'm talking about blood group, I want to emphasize on rhesus factors. This is the most important aspect, the most important test you have to run before you start making babies. Most important, and this is the most neglected, the most ignored, the most not known. Okay, most people do not actually know about this rhesus factor. What is rhesus factor? This rhesus factor is this antigen that is found on the surface of the red blood cells. Okay, so it's not everybody that has this rhesus factor, this antigen on their red blood cell. About 15% do not have it. All right, and whoever that has this this antigen on their red blood cells, they call it rhesus positive, and if you do not have it, it is called rhesus negative. Okay, so what am I talking about? That's why we have like A positive, B positive, AB positive, AB negative, O positive, O negative, those negative, positive, and all. This is called the rhesus factor. It is very important. It is very important. Please ask me why. I'm going to make a separate video why it is very. If you do not check your partner's rhesus factor, do not start making babies with that partner. It is very risky. It is super risky. Ask me why. Ask me why.